You're here today because you want real change. You're looking for real solutions. Your challenge today is to take the information that you've learned to continue to make sustained changes in your practice, in your hospital, in your community.
The importance of an organization like Partnership MCH and also this symposium, now in its third year, is just the way that we can share the latest and greatest information from research with the healthcare community, with those of us who are working in philanthropy, and also with our government partners.
You can see that the US is the odd ball compared to Germany, Japan, and Britain, to name a few, and that our maternal mortality is on the rise, while these other developed countries are on the decline.
New Jersey ranks 47 in the country in terms of the highest mortality and morbidity rate, which is devastating. We are on a mission to decrease that and to improve our maternal outcomes for not just one group of people, but for everybody and for their just entire family.
We know that complications of pregnancy occur disproportionately by race, by ethnicity, even by various socioeconomic factors.
In New Jersey, women of color are 7 times more likely than their white counterparts to die in childbirth. And Black children, infants, are 3 times more likely to not see their first birthday.
So the problems that exist in the Black and brown community are very much rooted in systemic racism and institutional bias. And we really need to work on that, and so that a person of color can present their problems and can present their complaints and be taken seriously and not be afraid to be discounted, because that has been done so often in the past.
It's really about providing person-centered care. Valuing a person's lived experiences are key to improving trust for women of color.
As someone who's experienced 2 preventable second trimester pregnancy losses due to systemic racism, I feel that this symposium really shed light, and it brought different people together from the birthing space to shed light on conversations that needs to be had.
This disturbing reality is a result of nothing other than institutional inequity and racism, and requires sweeping change to a system that has long failed our women and babies of color. For this reason, we have been hard at work figuring out how we can transform New Jersey into the safest and most equitable place in the nation to deliver and raise a baby.
In New Jersey, we are on the path to increasing recognition and response towards improving maternal outcomes.
This is something we can fix, but people have to recognize it. And we have to continually talk now about the bias issues and the racism issues, because they're real. And unless we address them and discuss them, we're never going to fix the clinical issues.
We're working on it together. We're innovating together
to ensure that New Jersey is the safest place to have a baby. All women in New Jersey should have a safe birth.